headaches are a very common problem in children. What would make you think a headache is not something, a little tension, a little migraine? What would be the things you'd be looking for that say this is a problem?
So a lot of children actually complain about headaches. It's a very common complaint in children. A lot of parents brush it off as just they don't want to go to school, or they're just they're trying to avoid things. Parents also don't realize that migraines are very common in children. They think that usually you get migraines at older ages, but we've seen migraines in 4-year-old, 8-year-olds.
But what would be that headache? Red flag, got to be seen right away.
So any new change, a new type of headache, sometimes even headaches upon awakening, sometimes you can have vomiting. Now, a lot of these signs also could be indications of other types of headaches, such as
acute change.
But an acute change would be worrisome. That's something that would need to be seen by a neurologist.
Morning headache and vomiting, we all know, could be a sign of something in the head. What about they couldn't move one arm, one leg, there was weakness in an arm, numbness in an arm? Would that be an indicator, too?
Right, so all these things are something that would be concerning and something that would need to be evaluated by a neurologist with an examination and maybe even some imaging like an MRI. But those are also symptoms that you can get in a migraine again. So it's not something you need to be run to the emergency room in fear, but it is something that needs to be evaluated very quickly.
In the summer, sometimes we worry about in August, September, of headaches, and sometimes related to a viral infection, encephalitis. So if you're not sure, you always call your primary care pediatrician or primary care physician, and he probably knows your child best, and you make judgments together. Is that correct?
Yeah, and any types of headaches like that, especially if they're associated with any cold symptoms or a flu, or you're worried about a meningitis, one of the things to look for is just any change in behavior. If the child's not acting the way he normally does, is very inconsolable, crying and really irritable, those are things that would be more concerning.
The common sense is the best rule.
Sure.